Hello everyone, my name is Bakheet Aljedaani and I am from the Center for Research on Engineering Software Technologies Research Group at the University of Adelaide, Australia. I will be presenting our work, Security Awareness of End Users of Mobile Health Applications, an empirical study. This work is a part of my PhD research and it's co-authored by Aakash Ahmad, Mansooreh Zahedi, and Muhammad Ali Babar. Here's the outline of my presentation. I will introduce the topic through a brief background and motivations. Then I will highlight the research objectives and walk you through the adopted research method. After that, I will present the findings and threats to validity. Finally, I'm going to conclude the presentation and throw out some ideas for extending this research. So, as we all know that we currently live in a digital technology era and many things have become smart, including mobile phones. Mobile phones have become an inseparable part of our daily lives and we carry them everywhere in our pockets. In 2019, 5.2 billion people, that is nearly 67% of the global population, subscribe to mobile services, with an expected increase to 70% by 2025. Mobile phones are considered unattractive for many reasons. First, portability, computational capabilities, context sensitivity, enhanced interactivity, user-friendly interface, etc. Mobile health apps, or mHealth for short, are on the rise with 350,000 apps available in the major app stores, that is Android and Apple Store. The market revenue for digital health expected to reach 31 billion US dollar by 2020. mHealth apps have the ability to connect mobile technologies and health industry to provide a variety of low-cost, efficient, and digitized health services. As we can see here on the right, mobile health apps can be categorized as general health apps such as patient management apps, clinical apps, and fitness monitoring apps such as activity tracking and nutrition apps. Despite the offered benefits of general health apps, security of health critical data remains a challenge. Compromising health critical data would lead to social, legal, and financial consequences. Now I will explain the role of end users and why we consider end user security awareness as an important research to investigate. mHealth apps on the one hand, mHealth apps developer on the one hand strive to ensure and deliver secure apps. Yet, technical solutions cannot address security alone. On the other hand, end users' understanding of security issues is essential to ensure secure mHealth app usage. End users find security which have been developed by the developers are hard to understand. As a result, end users can be misled by app permissions to disclose their health data, or end users can get deceived by hackers to leak their private information. So here's an overview of the methodology that we adopted. We have done a literature review to understand what studies have been done so far and what are the missing gaps. So based on that literature, we specify the research questions for this study, which are: the first research question is, what is the level of security knowledge, attitude, and behavior of end users about using mHealth apps? And the objective is to measure the level of knowledge, attitude, and behavior. We use descriptive analysis to report and answer these research questions. And the second research question is, what are the relationships between security knowledge, attitude, and behavior? And how do they influence end users while utilizing mHealth apps? So to find answers, the objective of this question is to analyze the relationship between knowledge, attitude, and behavior. And we used linear regression tests to find answers for this question. In addition, literature review allowed us to identify the security mechanisms and security critical scenarios that end users are concerned about. So we identified four main security mechanisms, namely privacy, access control, encryption, and authentication. And we identified 8 security critical scenarios, as we can see here. The literature also helped us to identify the data collection method. So we used human aspect of information security questionnaires. More specifically, we use CAB model, knowledge, attitude, and behavior model. So to define these three terminologies, here, security knowledge refers to what end users already know. Security attitude refers to how end users feel about that knowledge. And finally, security behavior refers to what actions end users perform to ensure security. And here is an example of a CAB model. For each of the 8 critical scenarios here, we identified 3 statements, one related to knowledge, one related to attitude, and last one related to the behavior. And here's the example. So we ended up with 23 statements. We excluded one statement because it was not actionable, and the given responses were true, false, or I don't know. The second research phase is outline the research hypothesis. So we outline 3 hypotheses. First hypothesis is security knowledge of the end users of mHealth apps has a positive correlation with their attitude. Hypothesis 2, attitude of the end users of mHealth apps is positively correlated with their behavior. And lastly, security knowledge for the end users of mHealth apps has a positive correlation with their behavior. The third step is collecting end user responses. So we collected data from two health providers in Saudi Arabia. Those health providers were purposefully selected because they provide mobile health apps for their patients. These apps contains health critical data such as medical history, lab results, radiology test results, etc. First, we conducted a pilot survey with 10 end users, that is 10% of our respondents, to find out any ambiguity. And then we collected 101 responses. And here on the left, uh, a snap of our demography information of our respondent. Interest reader can refer to the paper for more details. Last step, we perform data analysis. So since most of our data is quantitative, we used SPSS to help us report our results. So descriptive analysis was used for end users demography. We used Compact Alpha for understanding the internal consistency. We used Pearson Bivert to understand the correlations. And finally, we used linear regression test to understand and to understand the proposed hypothesis. So before going to the actual results, we wanted to measure the internal consistency of our survey statements. So we calculated the Cronbach alpha. The obtained results, as we can see here from the table, have met the minimum acceptable coefficient values, which is greater or equal than 0.7. Second, we conducted a Pearson correlation to test the strength and association direction between the survey statement. We found that all the survey statements showed a positive relationship ranging from strong to a very weak, except two statements had a very weak negative relationship. 61% of the survey statements had a significant relationship. To answer research question 1, which investigate the security knowledge, attitude, and behavior of end users about using mHealth apps, we use descriptive analysis, including means and standard deviation to find an answer. So end users have different opinion about the surveyed security issues, knowledge, attitude, and behavior. For one security mechanism, knowledge and attitude were contradicted. As an example of such a variance, two encryption-related statements provided to examine respondent knowledge and attitude toward applying encryption within the used mHealth apps. We found that 42% selected true for the knowledge statement and 46% selected do not know for the attitude statements. For answering research question 2, which is testing the first hypothesis, we use simple regression tests to understand if security knowledge influenced the respondent attitude. We found that knowledge had a statistically significant impact on the attitude, producing R squared 1.602. This means that respondent knowledge accounted for 60% of the variance on their attitude, and hence respondent knowledge is positively related to their attitude. To further answer research question 2 and find answer for the proposed hypothesis, We use multiple regression tests because we have two dependent variables this time. So we find that both knowledge and attitude have a statistically significant impact on behavior, producing R squared to 0.5 to 6. Respondent knowledge and attitude account for 52% of the variance on their behavior. Coefficient values resulted from the test indicated that attitude predictor is statistically significant. However, knowledge predictor is not statistically significant. So the key findings are respondents have different level and opinion about the survey's security issues. Such differences are mainly depending on different factors such as educational backgrounds, period experiences, etc. And based on the regression test, relationships results imply that we accept H1, knowledge is positively correlated with the attitude, accepting H2, attitude is positively correlated with their behavior, rejecting H3, security knowledge has security knowledge for the end user of mHealth apps has a positive correlation with their behavior. For threats to validity, we believe that our study might get affected by the self-reported behavior for our respondent. Also, the source of data collection, which is limited to two health providers in Saudi Arabia, and the size, 101 respondent, which can affect the generalization of the study. Finally, policies, regulation, and practices to be followed by health provider might affect our study. For our conclusion, we found that knowledge strongly influences respondent attitude towards security of mHealth apps. Knowledge does not significantly influence respondent security behavior. Out of that, we draw up some recommendations. First, security training of end users, threat analysis workshops need to be ensured by mHealth providers. There is a need to promote best practices to enforce security, such as multi-step authentication. And it is important to adopt suitable mHealth apps, trade-off between security and usability. For future work, we believe that this work can be extending through collecting more data with different health providers and end users at a global scale. We also believe that this study can be measured the security awareness beyond mHealth apps, such as social apps and mobile banking apps. And we believe that it can be extended by measuring the security awareness via simulation-based attacks. We acknowledge the research center at King Fahd Medical City and Dr. Suleiman Al Habib Medical Group for approving our study. We acknowledge all the participants who involved in this study. We also acknowledge the support of CRUST team members. Thank you. Any questions? Please feel free to email me at this email address. Thanks.